Good afternoon. Welcome back, everyone. I'm Sri Johnson. I have the honor of serving as the director of the Depression Center and also introducing our closing keynote speaker, Dr. Preeti Malani. Dr. Malani is a professor of medicine and in the infectious disease section here at U of M, and also finished up a really consequential and eventful term as the chief health officer here. Particularly during the height of COVID, both at the university level, the state level, the national level, we were extremely lucky to have someone with Dr. Malani's rare combination of skills of deep knowledge of infectious disease, incredible communication skills, as you'll soon see, and diplomatic and administrative approach to contentious decision-making, and having her speak and emerge as really one of the most trusted voices was key to my well-being during the pandemic, and I think for a lot of us. In addition to her MD, she also has a master's in journalism from Northwestern, and you can see those skills coming through in a lot of her different roles, particularly as a deputy editor at JAMA, and her frequent contributions to popular media through the New York Times and NPR and other outlets. In addition to all this, Preeti is a highly accomplished scientist, author of almost 200 publications, and editor of 5 books, and most recently the inaugural leader of the National Poll for Healthy Aging, which is making lots of contributions to our knowledge. We're really fortunate that she's turning her considered talents and ideas to well-being even more recently, and relevant to our conference. She's the co-chair of our U of M Wellbeing Collective Advisory Council, and thinking a lot about this issue. So I'm really excited for her talk, and I hope you'll join me in welcoming her to the stage.
Yeah, thank you, Srijan, for that very, very kind introduction, and to the planning committee for inviting me to give this closing keynote, and really to everyone who made this special conference possible, to our many donors, and to everyone who is joining us, both in person here as well as virtually. Thank you for everything you do to support those around you, and really to just make everything better. I'm personally inspired to see so many people at this meeting looking for new and innovative ways to connect the dots. You know, they asked me for a title for this, and I was like, let's talk about connecting the dots, and really rethinking student mental health, campus health in a hybrid world. And I'm gonna start with land acknowledgement. I know many of you have probably seen this during the conference, but just to take a few minutes to review and reflect and better understand the origin of the land on which the University of Michigan's Ann Arbor campus is located. So a quick disclaimer, unlike many of you, I'm actually not a mental health professional. I wouldn't consider myself that. I'm not a psychiatrist. I'm not a sociologist, a psychologist. I am a physician, but I really don't take care of a lot of patients in the outpatient setting, and frankly, people who see me, they're often very, very ill in the hospital. But I am someone who really thinks deeply about the well-being ecosystem of our campus, and I really have a public health lens for that. I'm a faculty member. I'm a Michigan graduate. I'm a member of the Ann Arbor community, and probably most importantly, I'm the parent of 2 young Wolverines. I had a student who graduated last year, and I have one who started this year. So that is, and I'm going to talk a little bit about sort of parents and families and their role in all of this. I've spent the past 3 years really working with dozens of colleagues, and most notably, a few that are here, Dr. Lindsay Mortensen, Dr. Rob Ernst, Diane Jenkins-Ali, others, really thinking about every corner of our university and talking about COVID, and really thinking about the fact that it's not just a medical issue with vaccines and treatments. It's really something that has affected every aspect of our life. Something that I said a lot during numerous town halls was that COVID is not the only risk to our health. And in fact, the emotional aspects of our well-being, social, academic concerns have remained front and center throughout the pandemic, particularly on this very large, decentralized campus like ours. So that's my lens, public health and connecting the dots. And I really looked for some kind of image to depict this notion of connecting the dots. And ironically, this image that I have up on the slides right now is from the School of Public Health, and it's actually about contact tracing. But you get it. It's the idea of interconnection. And I really hope to share a message with all of you that the end of the conference is really the beginning of action, and that it's the beginning of change. And whatever role, whatever you return to later today or tomorrow, I hope that you're able to be really intentional and think about what you're going to do with the new knowledge you've learned in your own spaces. And I also hope that you made some new friends while you were here, shared ideas, maybe even really built some new collaborations, and that those exchanges continue. At Michigan, we talk a lot about the team, the team, the team. Well, campus health is sort of the ultimate team sport, and we all have a vital role in addressing mental health and well-being. So during this conference, you've heard a lot about digital mental health strategies, telehealth, even virtual reality, health equity, capacity, data, evidence for prevention. And you've heard from so many experts, both from the University of Michigan and from all over the country. So many people who are trying to figure this out as you are. And again, like COVID, depression, anxiety, and other mental health concerns are a serious and very complex public health problem, and it's one that devastates individuals, families, and it can have lasting effects on communities. And addressing mental health really requires multiple layers of intervention, and there are buckets for prevention, there are buckets for treatment, and so on. So some people are joining in just for this session, and I thought I would step back a bit and talk about some background data to set the stage. And to be honest, before I started my role as the university's chief health officer in 2017, I really had no idea how prevalent mental health concerns were among college students. And I consider myself pretty aware. I mean, in the medical field, I'm mother of at that time high school students, but I really had no idea about this. And I wanted to share some data. A lot of this comes from the Healthy Mind Study, which is an annual web-based survey examining mental health, service utilization, and related issues among both undergraduate and graduate students. And it was launched in 2007. It's been fielded for more than 15 years. About 450 colleges and universities have participated, in more than 500,000 respondents. And we're so fortunate to have Daniel Eisenberg here. I don't know if he's still here or not, but I had such a nice time chatting with him yesterday. It turns out, a very Ann Arbor moment, that he and my brother are good friends and that we had met at a social event several years ago. But Daniel, I've admired the work that you and your colleagues have done for so many years. This article was published in 2022, and it's in the Journal of Affective Disorders, and it includes data from 2021, so it really includes that pandemic time. And I just want to emphasize, these are national data with really strong response rates, and it's a moving snapshot of what's happening on U.S. campuses. The website, if you haven't checked it out, is great. I was looking at it earlier in preparing for these remarks, and there are a number of really wonderful toolkits as well as data slides. So the results really show that students' mental health has steadily declined since 2013. And in fact, Dr. Eisenberg and his colleagues reported that more than 60% of students during the 2020-2021 school year met the criteria of one or more mental health problems, such as major depression and anxiety disorder. That's nearly a 50% increase from the 2013 data. And again, maybe it was a little higher because of the pandemic, but the point is it's going in the wrong direction. Some other things, just some facts and figures to throw out to you for context. 63% of college students say their emotional health is worse than it was in 2019. Can I just sort of look at the room here. How many of you feel that your emotional health is worse than 2019? I certainly would raise my hand, and I think most people would. So it's, students, again, they reflect, and our campus, our staff and faculty also reflect that same reality. 60% of students have difficulty coping with stress in a healthy way. Instead, they often will look to unhealthy ways to cope. And something I've learned a lot from my good friend, Mary Jo Dupree, who's been here, leading our efforts of well-being through Wolverine Wellness, is that substance abuse continues to be one of the most serious negative coping mechanisms. Alcohol, drugs, vaping for that matter, these are all things that can interfere with coping. 56% of college students are concerned about their ability to care for their mental health. And it's more than half. 30% of college students reported feeling so down at some point during the previous year that they found it difficult to function. Wow. Unfortunately, these data also show that the vast majority, 93%, of students who experienced anxiety or depression on college campuses have not used the mental health services provided. And again, this is the idea of connecting the dots, and so much of the work that you have done the last 2 days. And when we ask why people haven't sought care, most often it was because they didn't think their distress was severe enough to warrant professional support. I'm just going to say that again. They didn't think that their distress was enough to warrant professional support. Some people were uncomfortable interacting with people that they didn't know, talking about mental health problems by phone. Others worried about cost. Even though stigma has improved, it's improved a lot. Many worry about their parents, their families, their friends finding out that they're seeking care. People who don't work in this field day to day, they really ask about the why. Why record numbers of young people are experiencing mental health concerns. And, I don't have an easy answer except to say that it's not one simple thing. It's not just social media. It's not just the pandemic. It's not just we're pushing our kids too hard. In fact, long before COVID, depression on college campuses had become increasingly prevalent, and counseling services have been unable to keep up with the need. And again, the why is way beyond my comments for today, except to say that young adults are really coming of age in a complex world. And I know there are many of us, many young adults who are here with us today, and many people who care about the lives of young adults. It's climate change, systemic racism, income inequality, political divisions, gun violence, and of course, social media. Young people, I'm sorry that older adults have really failed to protect you. I think you deserve better, and I really hope that we can all do better for some of these things that really need to feel better. While we might not understand all the whys, we can talk about who is at risk. And the easy answer here is that everyone is at risk. No one is protected. But there are some groups that experience higher rates of both anxiety and depression on college campuses. And again, these are big picture groups. Students from low-income households, non-white students, female students, students who identify as LGBTQA+, students who are caregivers for children or adults. And we may not ask about those things. We may not even realize that people are caregivers. They may have siblings that they're caring for. They may have children of their own. They may be helping with a parent. And this really became an equity issue during the pandemic. It was something that we thought a lot about in terms of the ability to continue learning in a remote environment, and how difficult that was for some people compared to others. On our campus, international students are another group that have been deeply affected. And I was just talking to my good friend and really longtime mentor, Michelle Reba, about this issue that cultural considerations may be different in terms of seeking help. I had a chance yesterday to speak with Judith Pennewell, who's our director of our international center. And I mentioned to her, Judy, I've heard that a lot of students who their home is in China have been very affected the last few months, with many of them losing grandparents unexpectedly to COVID. And she also added that, the discussions right now around the origins of COVID are really bringing up a lot of trauma for people. So it may be things that, we all talk about stressors, but there may be things that are unique to some groups. So speaking of stressors, college students report that their most common stressors are academic concerns, which really can be experienced as failure. There's a lot of concern about grades. And I'll get back to that a little bit. Identity concerns, relationship concerns with roommates, romantic partners, family members. During first year, there are a lot of students who have homesickness. They miss home. They're on their own for the first time. They're lonely. Graduating students also have anxiety about next steps. And I'm told by counselors that those are really the high-risk periods, that the first year and the fourth year for sort of a traditional four-year college path tend to be very high-risk periods. Loneliness and isolation, and I'm going to spend some time talking about that. The lack of coping skills, feeling of hopelessness, perceived or actual lack of support. And I think that's a really important one. And I think it's one that we can try to think about and fill in as family members as well. Difficulty concentrating, disrupted eating, disrupted sleep, lack of sleep. There's a lot to do here. And sometimes, sleep and, those big monster caffeine drinks and, just really poor habits. And this can all be additive. The consequences are really important. And it's not just simply that people aren't thriving or that they're not doing well in class or with their social interactions. This really has very, very high level implications. And in fact, withdrawing from college due to depression has become a frequent occurrence among young adults. And the national data suggests that about 2/3 of students who drop out of college did so because of mental health disorder. So this is a retention issue. It's an economic issue for families, for students. It's an academic issue and something we need to care about. Moreover, and I think this is really important in terms of connectivity and connecting the dots, about half of those who ended up leaving college with depression had not accessed any mental health services while on campus. So again, this can vary, but it's unacceptably high. In terms of consequences, I do want to take just a few moments to talk about suicide, even though it's a very difficult thing to talk about. It's difficult for me to talk about. Suicide affects all ages. It affects all types of people. But the college age group has a higher suicide rate than others. And in fact, it's the second leading cause of death among college students. And I know, and I missed this, is that Donna Tran spoke a little bit earlier about Asian Americans, Native Hawaiians, and Pacific Islanders, and some of the unique mental health consequences. I don't know if Donna is here, but I saw it on the schedule. There are certain groups that are at higher risk, in addition to certain ethnic groups, certain racial groups. Young people who identify as lesbian, gay, bisexual, they have higher rates of suicidal ideation compared to their straight counterparts, to their peers. And I also want to acknowledge the enormous risk emotionally to individuals that identify as transgender. And this is obviously a very, very diverse group, but it's one of the groups that really has some of the highest risks for suicide or suicide attempt. And people with disabilities also have a higher risk. So when we think about our campus, being very, very inclusive in these spaces and really thinking about connectivity. So among all these awful statistics, there's also very, very good news. Suicide is preventable. And through evidence-based interventions, there's been a lot of successes here. Depression can be managed, it can be treated, it can be identified. I did want to remind everyone of the crisis suicide hotline 988. This has now become national. It's an easier number to remember, and many of you are very familiar with those resources. Closer to home, the team at CAPS and the health service has supported our students, really helping them continue their education during difficult times. I had a nice chat last night at dinner with Todd Sevig, the director of CAPS, and I, of course, saw Chris Frank. He's in the audience today. He and Lindsay Mortensen are our leaders at the health service. And, what I've learned from Todd is that the team at CAPS has really tried to frame their work with several important questions, including how can we promote and offer tools to support hope and resiliency? So it's not to cure, not to medicate, but really like that idea of hope and resiliency. And I like that framing. And how can we address and accomplish a culture of caring for students in any level of psychological distress? I wanted to show this schematic. This is actually from the Wellbeing Collective, and I actually really like this schematic. It might be hard to see from the audience, but that idea of some things being intensive and targeted at the top, inpatient care, recovery care, case management, and then towards the bottom, the idea of universal, general things that help mood. And again, these don't replace counseling and medication, but these are adjunctive therapies, and they can really work as prevention for entire communities. And I just wanted to list a few things. The idea of routines, of consistency, the idea of movement, of exercise versus being sedentary, good sleep. And I understand that March there's a effort on our campus to talk about sleep, both for students as well as faculty and staff. I'm someone who doesn't sleep well, and so I'm going to try to engage with some of those resources. Positive reframing, taking breaks, eating meals with other people. I think that's something that somehow has gotten lost. Just taking time to eat and sharing food with another person. Paying attention to nutrition, and a lot of schools and colleges are also paying attention to food insecurity. And I think that this is a really important link, and it really is being thought of as a key to success, to academic success. And on our campus, the Maize and Blue Cupboard has really done tremendous work at trying to address the many things that go along with food insecurity. It's not just, again, a simple issue, but people often have many needs in addition to food. Using social media for positive interactions and really shutting down the negative. I know one of my kids loves to look at videos of animals on social media, and I've actually gotten into it a little bit too. It's a nice break. Speaking of animals, therapy dogs, and I know that Hawkeye is quite popular on our campus. Nature, journaling, listening to music, mindfulness, connecting with friends and family, either virtually or in person. Ultimately, it is that stackable set of interwoven interventions that can enhance mental health and safety for the entire community. So I'm going to move on, and I'm going to talk a little bit about parents and families. And for simplicity's sake, I'm going to use the less inclusive parents, but really this means parents, grandparents, siblings, guardians, friends, others who support our college students. Parenting doesn't end, but it does change when your student goes to college. And Mary Jo Dupree has really helped me understand this, is that college is really that transition time from you being the primary caregiver for the student to your student learning to care for themselves. And I'm sharing a photo. These two pictures were taken exactly 30 years apart. Believe it or not, almost in the exact same location. And they were taken on the 5th floor of Mosher Jordan Hall. I am in room 564, and just by chance, my son ended up in room 577, 30 years later. And, you can kind of look at the mess that I'm sitting in with books everywhere, and there's a calendar, and there's like a wipe-off board, and he's sitting there with a clean desk and his phone. And I didn't really actually intend for these pictures to be side by side. They just ended up really being kind of fun to look at. And I will just say that everything has changed about being in college. The way you study, eat, live, how we communicate, it's very, very different. And I think that there are parents who, well-intentioned, are not fully understanding that they're not going to college, that there's no we in like that parent-child dyad in terms of going to college. And it's just a high-level observation, but there is some sort of maybe less helpful over-parenting that happens on this campus and others. And just for example, the Facebook parent pages, which are interesting. They're kind of an interesting way to kind of figure out what parents are concerned about. But parents, you don't need to connect with other parents to find your child a roommate. Like, let them do that. let them figure out what classes they're going to take. And when my younger child is a first-year student here and did the remote orientation, she said, Mom, they said 3 times that parents cannot come to the counseling appointment in terms of picking classes. I was like, wow, that's really something. I'm pretty sure my parents had no idea what classes I was taking when I was a student. But again, that doesn't mean you shouldn't be supportive, that you shouldn't be involved, but I will say independence in the ability to make decisions and navigate campus, it is an essential life skill, and it is something that is protective against mental health difficulties. It facilitates better mental health. It's also just an important life skill. So I kind of frame it almost like a vaccine, really letting them make those choices, and even if it means making mistakes and things not being perfect. And for parents of younger children, this is really something to work on today, really developing independent living skills. Something that I think has been lost during the pandemic is organization and time management. And I think this has certainly been true for one of my children who, spent a junior year remote. Those are some things that you can work on, and they will really pay off. I also think, this is, again, just my personal advice. I think helping set realistic expectations about college and the big picture that, you're there to go to school. It's not going to be one big party every minute. It's hard work. Sometimes you may feel lonely. You will feel stressed. For parents and families, really spending more time listening and less time telling your student what they should be doing, where they should be, who they should be with, what fraternity or sorority to rush. It is a very different experience today to go to school. And again, I think these photos are just a little bit of an illustration. I think it's helpful to discuss what that everyday, day-to-day involvement should look like. And for example, should you be tracking your student on campus? Maybe not. But a lot of parents do. And some of them even reach out to professors and say, why didn't my child come to your class? So, I think, again, Sarah Daniels, who's our amazing associate dean of students, she gives a great analogy that it's really about coaching versus playing. And you are a coach, you are on the sideline. You can support and cheer and give, sort of general guidance, but you're not in playing the game. And so I just wanted to kind of give that high level, trying to really right size where parenting could be and where it should be. Now, I want to say at the same time, and I want to shift, that the student who is struggling, this is not something that they can really handle independently. And a person in distress may have a very hard time engaging with care. Communication is essential, and family support is really critical for students. So, again, really figuring out how to right size that involvement and what you should be focused on. By all means, parenting doesn't end when you drop off your child at Mosher Jordan or East Quad or wherever you drop them off. And as I've noted, many students are having issues with depression and anxiety. They're reluctant to seek help. And, I have walked this journey with several of my friends and colleagues, and these are well-connected, medically sophisticated people, and it has been a struggle. It is very difficult. So just like any other chronic health condition, having a plan around mental health is essential, and really figuring out that transition ahead of time, and whether it's health insurance or out-of-state, virtual care, because what you really want to do is avoid a crisis. And again, you had a lot of discussions the last 2 days about crisis, and unfortunately that does happen, and there are ways to intervene there, but the more we can do on the prevention side, the better. For some students, these symptoms can be new. They may not have come in with any known difficulties, and parents should also be aware of some of the common symptoms around depression and anxiety. And this might be a loss of interest in social activities, difficulty with schoolwork, sense of being overwhelmed. They may not be eating well. They may not be sleeping well. They may lack energy. They may have emotional outbursts, hopelessness, crying, anger. And, I want to come back to that communication piece. It's really, really critical. Parents, they often worry that somehow talking about the signs and symptoms of depression might be poorly received by their student. And the experts, many of you on this campus have told me the opposite. And that, in fact, the recommendations are to be direct and to provide examples of things that you're concerned about. Be calm and practice empathy in your communication, and really help students try to understand that these are common feelings and that there are effective ways to treat mental health concerns. And again, help meet them where they are. Resources on campus are helpful, and there is a genuine effort on our campus and others to improve access. And again, that's been the theme of this year's conference. I will say that your student's primary care provider is also helpful. And, so much of primary care for young adults really lives in this mental health space. Parents and families should be aware of HIPAA, and this is really confidentiality rules related to healthcare. So at age 18, students really have to provide permission for others to learn anything about their medical information. And this is for parents, families, as well as for university personnel. And one of the unintended consequences of HIPAA is that some students can fall through the cracks, and a student may be doing poorly and no one may know. And so I think, again, having some awareness and constant communication. One thing that I've had my adult children do is fill out a friends and family form. I don't micromanage their health issues. They communicate with their doctor by portal, and they set up appointments. But I've asked them, and they have agreed to fill out this form so that if there is an issue, I can try to be helpful to them. But again, I think those are really important adult skills too, just that ability to navigate your health insurance, how you're going to refill prescriptions. So I'm going to shift now to talking about students. And do we have students in the audience? We have some? Yay. Okay, great. And I know that there's some tuning in. So I'm a Michigan graduate. And for me, coming here was transformative. For me, it was really like the first time in my life where I really felt like I could hold up my head high, and I felt welcome. I was with my people. And, that was really powerful for me to feel that sense of belonging. And it wasn't something that I really felt naturally in the community where I grew up. I grew up not too far from here, but I went to a smaller high school. I grew up in a small community. And it really breaks my heart when I hear that students don't feel that sense of belonging. And, I just want you to know that you are loved, and that you are so important, and you are so valuable, and you make Michigan better. This next slide really breaks my heart to talk about. It's about loneliness on campus. And I think this is something that I want to spend a few minutes talking about. This is from the National College Health Assessment, and it's done every couple years. I'm purposely showing you 2018 data because I think the pandemic has kind of changed things a bit. This is just simply a response. This is from our campus, and these are available on the University Health Service website. There's lots of information there. This is, I have felt very lonely. 64% responded that they felt very lonely. And it's an incredible number to me. I will say that this is not a perfect sample. Unlike the Healthy Minds, which is really nationally representative, very robust, this is like a snapshot of our campus. And it may be that more people who are lonely responded, but maybe the number is actually higher than this. For context, I wanted to share some work that just got published a couple days ago. This is from the National Poll on Healthy Aging from our University of Michigan's poll, and this is for the Institute in Healthcare Policy and Innovation. And we have looked at feelings of isolation and loneliness among older adults since 2018. It's something we got interested in. It's a health issue, a well-being issue. And in 2018, when we asked 50 to 80-year-olds, overall 27% talked about feeling isolated. And during the pandemic, that number skyrocketed to 56%. And of course, that was really in the height of stay-at-home orders and things. And the number has slowly come down, 46, 44, 34%. It hasn't come back down to normal or to the baseline. And that baseline is still too high. And again, I just want to go back to this number, 64%. I mean, that is an incredible, incredible number to me. And students, you're going to have to figure this one out. But even if 64% is a little higher than it really is, maybe it's lower, but just imagine 60% of your classmates are very lonely. So say hi to them. Get to know people in your classes, in your residence hall. Get involved with something. Volunteer, clubs, social groups, faith communities, affinity groups. The Center for Campus Involvement at the University of Michigan is a great resource. Dr. Lindsay Mortensen says something that I'm going to repeat here. It's connection is protection. And this is truly life or death. Connection is protection. I will say that you're not going to have an opportunity later in your life to meet so many people that are different than you. And if you're going to work in healthcare or education or virtually most fields, you're going to really work with a lot of different kinds of people. You don't need to have 100 friends, but please try to have a couple good friends and be inclusive. Make a friend, take a friend. I also hope that you'll use this time to really engage with your health, make good decisions, to learn how to make an appointment, how to fill a prescription, and really learn skills around resilience. And I will say, by the way, call your family. They miss you, and they like hearing from you. Call your mom. I did want to talk about classes and academics. This was sort of interesting. This came out last week in the Daily. It's time to stop dreading Michigan math. Classes are hard. And I think they're certainly hard on this campus. They're hard on other campuses. I think it's helpful. I know that academic stress is such a big stressor for people. Trying to keep grades in perspective. And I just want to read something from this article, and this just came out last week. If Michigan Math 115 is your first time taking calculus, drop it, because you will not survive this. It is a common sentiment among U of M students that if you take math courses at community colleges, you should. There are a few courses on campus so difficult that students recommend you go in knowing everything you're supposed to teach you. I mean, that's kind of ridiculous. But I will say, I'm disclosing, maybe this is too much information, but if you go back and look at my transcript from college, you will see Math 115 on there twice, because I was one of the students who had to withdraw from it. And I wasn't very well prepared. I wasn't very good at math. I didn't know how to study. I'm sure I was overwhelmed socially and academically. I barely got through Math 115. So I think if there's anyone out there listening who can fix this, please do. Because, I never went to Math 116, which meant I didn't get to major in a science. Not that that is the end-all, be-all, but I wonder, I had a lot of tenacity, and I, stuck it out, and I ended up going to medical school, but how many people are we, writing off because of a stupid math class? So anyway, I'm going to digress a bit, but I just thought that this was important, and I think for people who are in a position to sort of improve well-being, please think about these things. Not to say we should give everyone an easy route. I mean, calculus is hard. It's meant to be difficult. But the fact that 25% are close to failing just seems excessive to me. So anyway, this is the model of well-being at U of M, and this is one that probably many of you have seen. It's really meant to encourage all students, faculty, and staff to tend to every aspect of their well-being, not just the physical, not just the emotional, but the social, environmental, financial, occupational, spiritual, all the aspects of their lives. And with this in mind, mental health is health, but the converse is also true. Health, and I mean physical health, getting routine medical care is mental health. And I'm going to spend the rest of my time just giving you some examples. And I'm sharing this with permission. There's a student that I've gotten to know well, and she's overcome a lot of barriers to be at Michigan, and she's doing very well academically, despite having a high school that didn't really offer APs or advanced classes. She's very resourceful. She and her siblings were all covered with Medicare and Medicaid, and when she turned 18, she lost that coverage. And in fact, she went without health insurance her whole first year at Michigan. And she shared with me that not having health insurance overshadowed every single thing she did that year. When she crossed the street, she said, wow, I might get hit by a car. She went to the gym. She thought, what am I going to do if I get hurt? What if I get COVID? It turns out, she was really, really overwhelmed with this. And it also turns out that the University Health Service has an outstanding resource to help students navigate the Medicaid application process, but she didn't know about it. And Michigan is so big that connecting these dots can be hard. So her distress was not related to academics. It was not related to her roommate or like family issues. It was really related to her fear over her health. This past January, one of a really great medical student, Sydney Perkins, he worked with me on infectious disease consults, and we got to talking about the fact that a lot of our graduate students, in particular our medical students, have aged out of family health insurance. And the average age of our medical students entering is 25. Many of them do 5 years or more. So they are no longer eligible for family coverage. And again, we were just talking about access to care, and we were talking about mental health. And he put together a quick 15-item survey and sent it to every medical student, every MD, PhD student. And he closed the survey after 100 responses. He got 109 responses. And it was really a high-level survey to just identify healthcare barriers that might be addressed through programs or policy. And, some of the take-home, I'm just going to give you some take-home points, and then also just read a couple of the narratives, because I think they're very, very telling. 32% did not have a primary care physician in Ann Arbor. And again, they'd been here for years in most cases. 20% had not followed up with a primary care provider in more than 2 years. And I mention this because mental health is very much in that primary care venue. It's not in psychiatry and counseling all the time. Primary care is a really important piece. 35% did not have an optometrist or ophthalmologist in Ann Arbor, including people who they couldn't see. They couldn't see the electronic health record. More than half did not follow with dentistry in Ann Arbor, and a large portion had not seen a dentist in more than 2 years. Of the 75 of 109 reported following with mental health professionals, but a portion of them had not seen anyone in 2 years because of scheduling. Most common reasons for healthcare deferral was unable to schedule time during medical school responsibilities. That was 83%, followed by insurance not accepted. So again, insurance and access are not always in hand. Lack of insurance coverage was also noted. And I will say that the medical students are required to have health insurance. This is a slide that Sydney put together, and just in terms of the type of care that was deferred, dental care, 62%, health maintenance exams, 54%, vision, 40%. And again, I just want to read a couple of the narrative comments, and then we'll wrap up. These are just, again, these are comments from our students. I've had Medicaid for the past 5 to 6 years. I've attempted to use both vision and dental services through them, but have been met with so many barriers that I ended up using loan money to pay out of pocket for vision services at Target. Since coming to medical school, I've noticed that my prescription has changed and that my glasses and contact lenses are no longer very effective. My contacts are newer prescriptions, so I make sure to wear them when I drive. But honestly, I'm afraid to drive in the snow without new prescriptions. Another person reported using the lenses for much longer than recommended. I've been struggling to find a dentist who accepts Medicaid in the area, who has openings and availability. The dental school here has a low-cost clinic, but they are booked out months in advance. I have a known cavity that I cannot get filled due to cost and cannot get seen for regular cleaning. I try to make most routine appointments for mental health during quieter months, but this sometimes means I go less frequently than recommended. I stopped going to counseling during clinical rotations, which, by the way, are stressful times for people. There's an urgent care near my house where I go if I need timely care, because I don't need to make an appointment and I can go in the evening. Others talked about the feeling that if they asked for time away, even for legitimate reasons, that their grades would suffer. I'm going to read a couple more comments. I've also haven't been able to find a mental health provider while on my leave of absence, since I have Medicaid and can no longer see the medical school therapists. This brings me to a point that Dr. Rob Ernst talks about, is that being enrolled as a student is actually protective. And again, when students take leaves of absence, they often lose some of that ability to engage with the support system. It's impossible to schedule medical appointments during clinical years because medical students don't get personal days, sick days that we can use for appointments. Asking for time off is perceived poorly by many preceptors and can have negative repercussions on clinical evaluations. During my clinical year, I was told on multiple rotations that I was strongly discouraged from scheduling any time off for appointments, even though it is technically medical school policy to respect medical appointments. It is hard to find time to schedule multiple appointments as I have certain health concerns that are more urgent. I have not been able to find the time to schedule a dentist appointment for 2 years. Not knowing the clinical schedules until 1 to 2 days in advance makes it extremely challenging. I'm going to read this last one because I think this is one that really I found very poignant. I found it really difficult during my clerkship year to make time for appointments for my chronic illness. While I had explicit permission to miss clinical time for appointments, I felt uncomfortable letting my team know that I had to leave the clinical environment at the frequency in which I actually supposed to have my appointments and diagnostic testing. Managing a persistent chronic illness during medical school is quite challenging, and I often deferred appointments and testing for months and got sicker because of that, as I did not want my preceptors to think I wasn't a hardworking clinical student. It can also be hard to find space for appointments that take place virtually. There were certain times that I was able to find an unoccupied student call room. However, there were other times where there was nowhere private I could take calls from, so I felt like I could not schedule my appointments during certain rotations. When I was on outpatient days, I had appointments virtually. I stepped out of the clinic to take video appointments from my car, which was not ideal, but it got the job done. Furthermore, I have a specialty medication that insurance will only cover if it is filled at a certain pharmacy in town. I have to pick it up every 3 weeks and immediately refrigerated it. It was really hard to manage this during the clinical year as the specialty pharmacy has limited hours and I would have to go home right away. And it goes on, overall, the burden of managing chronic illness during clerkships made me feel isolated from my peers who I felt were able to focus more of their energy on their actual clerkship, where I was always feeling stress related to the logistics of my medical care and how to keep myself healthy and functional while also showing up and looking dedicated to my clerkship. And again, there's more, but I'm gonna kind of move on because I wanna leave a few minutes for closing and for questions. You know, I've taken you to a lot of different places, and I really wanted to talk about the medical piece and how we can build really wonderful digital health strategies around mental health, but let's not forget about the chronic health concerns and the routine things like eye care and dental care. Hopefully, these wide-ranging comments have helped connect some of the dots for each of you. We're not powerless. You know, we've spent the past 3 years figuring out something that was impossible, how to continue the educational experience in the midst of a global pandemic. And I think if we can harness some of that same energy and innovation, we can totally do this. And there are things each of us can do to fill those gaps, to really do things, not, for ourselves, for those around you. Not everything can be fixed, not every stressor can be eliminated, but by working together, I think we can certainly practice kindness, we can listen, we can learn resilience, and we can improve the college experience while preparing students for the challenges that lie ahead. Thank you for your attention, and thank you for everything that you do.
Thank you, Dr. Malani. I know we handed out some note cards, so I can collect them, but if anyone just wants to use the microphone to ask a question, are there any questions? Oh. All right.
And that kind of thing. What can I do to help them? Because they have dental and they have doctor's appointments and that kind of thing. And I'm wondering what I can do to help them.
To help the students?
To help the people at Hope Clinic in Ypsilanti.
Oh. I'm sure the Hope Clinic in Ypsilanti can use a lot of help. I mean, it's like a wonderful resource. Maybe start by asking them what can be helpful. Okay. Yeah, like that would be, I bet a lot of people don't ask, so thank you.
Any other questions?
And I'll stay back if people prefer to ask privately too.
Yeah, go ahead.
So a lot of the conference has been about a sort of interface of brick and mortar resources for students and remote resources. I know that you work lots of different areas. I think for a lot of us, it's hard to figure out exactly which way to go, because we don't want to degrade our brick and mortar resources, but we also want to offer things that students want. How do you feel like we should balance that?
Yeah.
You know, wanting to make things easy for people, but also knowing that sometimes making things easy isn't always what people need.
Yeah, thank you, Chris, for that question. Just that around, and I'll repeat the question, the idea of like the brick and mortar health delivery versus, virtual care versus, sort of different hours. And, I will say, and I say this all the time, but the University Health Service on our campus is just a wonderful resource. And, I said, when my children were students, I felt very good about them getting their care there, even though they had their own personal doctor in Ann Arbor. I think, and you have a big student advisory board, really, like, you need a little bit of both. I mean, it's just, again, like the space I work in where we're using telehealth for certain things, but there's nothing like actually seeing somebody for some things. So, and you've expanded hours, you've expanded, made it easier to make appointments, the urgent care slots. It feels like you and Lindsay and others have really rethought that. But, the point is the need ends up endless. And I read a few comments from the medical students, and, those to me, and I just wonder about, is there a way to expand after hours access, particularly for those in programs where there's not flexibility, not just because, well, I don't feel like going at 9 a.m., but, really I'm thinking about our professional students mostly who are delivering clinical care all day. So, I suspect that balance is going to shift more to virtual, but there's certain things that we just need to see students, right? And again, they're nearby, they're around, and sometimes getting them in, you can learn a lot more. But I'm curious to know what where you're thinking, especially after I read all those comments. Yeah.
All right, thank you so much. I think I'm going to let Dr. Sen close us out now. Thank you.
Thanks so much, Preeti, for that really thoughtful and personal and really interesting journey and talk. And thanks also to Lindsay for her opening keynote address and all the speakers. Let's have a round of applause for everyone who's here today. At the Depression Center, we're really interested and focused on developing new treatments, new digital treatments, and improving access to care. But maybe even more, we really want to catalyze innovation and research in sort of that bottom row in Preeti's pyramid from the Wellbeing Collective of how we live our lives and interact with each other and our schools and workplaces and communities. So far fewer people struggle in the first place, and with the rates of anxiety and depression and suicidality that you covered, and from the Healthy Mind study, that our campuses are really the first line for that. So it's been wonderful to see everyone come together these last couple days and from all different levels and experiences and across the country, and share creative ideas on how we're thinking about that and changing our campuses and how we approach. And I hope you've all enjoyed it and really left energized and see this as the beginning of the journey, like Preeti said. I wanted to one more time thank the people who were really important in bringing this together. First, the families that were really important in financially supporting this and helping keep this event free for students and let us come together. The Eisenberg family, Catherine and Tom Goldberg, the Orley family, and the deans of our schools at Michigan to help support the conference. And I want to thank the team that really did all the work in bringing this together. Stephanie Salazar, who's the mastermind behind the conference. And the folks standing at the back there, and up here, Taylor, Lizelle, Will, Connie, Sarah, Valerie, Julie, who did a lot of work in putting this together. So thank you guys. As Todd mentioned, the opening, this, I think this is the 21st version of this conference. It's been going on since 2002, and it's really great to see how it's grown and how the conversations have changed, at least in the 13 years I've been coming to the conference. It really didn't feel the same the last few years when it's been virtual, and wonderful to have it in person again and coming together, and I hope everyone felt that. Stephanie let me know that the dates are set for next year for March 13th and 14th, and I hope you guys will put that all in your calendar and meet us back here in whatever that is, 364 days, and have a great year and report back. So thank you, and we'll see you soon.